What I want to do first, I want to ask the audience a question. I want to know if I have to work hard or if Cheryl has to work hard. So I'm going to give you three choices. How many of you think the ACA should be repealed? How many of you think it should be repealed and replaced? And how many of you think we should leave the ACA alone or strengthen it? So raise your hand if you think the ACA, the Affordable Care Act, should be repealed. Thank you. How many of you think the Affordable Care Act should be repealed and replaced with something? Quite a few. And how many of you think we should leave the ACA alone or strengthen it, improve it? No. Well, I think you have more work than I, Cheryl. So what I want to do is leave you with 4 points this morning. One is that the Affordable Care Act is working. Two, that it really was subject and still is subject to a lot of myths, lies, whatever you want to call them. And I also want to leave you with a thought, which is from my boss and other Democrats, is we are willing to improve the act. And the fourth point is, the Republican plan would take us backward. And I do think we can block repeal. And I'll explain why. So first, the Affordable Care Act is working. In the first quarter of 2016, we reached our lowest uninsured rate in history, 8.6%. We've gotten 22 million more people insured. And also the individual market, which is really a hard market to give insurance in, we've made sure that people with pre-existing conditions, one, are not denied coverage, are not charged higher rates, et cetera. So we've gotten more coverage. Second, we have reduced healthcare costs to their slowest rate of increase in 50 years. We have lengthened Medicare solvency by 11 years. And as a result of that, workers are taking more pay home in wages. They may not always realize it because lots of a long-term trend, workers are being forced to pay higher deductibles, higher copays, et cetera. But the point is that our national health expenditures are growing at a slow rate. And then we've also improved the quality of our healthcare system. We've lowered Medicare readmissions rates. There are less hospital-acquired infections, so we've improved the quality of our health care. And I'm not saying these last 2 points are all due to the Affordable Care Act, but I think they played a role. The second point is, our current president is still calling the Affordable Care Act a total disaster. You all heard about death panels. There was no such thing as death panels. And as a result of that, many of the elderly believed it. And, in 2010, the Democrats lost 63 seats in the House, mainly because of, I would say, those lies. We also, another lie that contributed to the elderly's, I think, misunderstanding of the act is the Republicans argued we cut Medicare by $500 billion then, and then the number changed to $700 billion. Well, what do you think when you say Medicare has been cut by $700 billion? You think they've cut Medicare benefits. No, that's not what happened. We actually improved Medicare benefits. We closed the donut hole in the Part D program, but we slowed down the cost of Medicare. That's why it was cut. And Medicare Advantage plans took a bit of a hit, but enrollment has surged in Medicare Advantage plans. So, and we basically said to the hospitals, because we're giving you 22, 25 million more paying customers, we can afford to cut the hospital update factor. And those are some of the reasons that Medicare costs were slowed. So I think right now, ACA, according to the latest polls, is enjoying the most popularity ever, 53-45, and I hope we can overcome, because clearly the Affordable Care Act was not a disaster. The third point I want to leave you with, yes, there were some mistakes. Healthcare.gov didn't work immediately. There are premium increases in that individual market in some states that are too high. We can fix those with tweaks. We can do permanent reinsurance. We need to stabilize the marketplace. In California, where my boss is from, we have 11 carriers. The benchmark plan only went up 4% a year. Peter Lee and the Covered California have run it very well. So that's my shining example that the Affordable Care Act can work. And my fourth point I want to leave you with is that the Republican plan, as we see it, and I realize it's still changing, there was a leaked document on Friday, but basically they do not have an answer on pre-existing conditions. They basically want to roll back the Medicaid expansion in all states. Now they're going to let some people stay on until they go off naturally, but they're not going to allow new recipients to come onto the plan. And they think about this, they think we should have one flat refundable credit that only varies by age. So if you're in a family with $30,000 and need to buy a health plan, or if you're in a family of $150,000, you get exactly the same flat credit. It does not vary by your income. How do you expect that they're going to, and one of the problems right now, the rumor mill is, CBO basically told the Republican staff that this plan, which is going to cost a lot of money because you're giving credits all the way up the income scale, it's not going to help many people at $30,000 of income get coverage. So the Republican plan goes backward. Now, Cheryl will tell you a different story, but the last thought I want to leave with you is I think we can block repeal. We have 119 Republicans in the House in Medicaid expansion states. Governor Kasich, a Republican from Ohio that you probably heard about in the presidential elections, et cetera, et cetera. Governor Snyder, another Republican from Michigan, I heard him say very good things. These 16 Republican governors in Medicaid expansion states want to hold on to that Medicaid program. It is doing a lot of good. It is helping fight the opioid crisis, the mental health crisis, et cetera. And as a result, that Medicaid expansion got 12 million more Americans insured. So I think there's a group in the House, the Tea Party group, that wants nothing. They want plain repeal, and a couple of their spokesmen said last night what's even on the table is too far, it's too liberal. And then we have another group of what they call the Tuesday group of about 50 Republicans, mainly from Medicaid expansion states, that want to hang on to Medicaid. So as long as Republicans can't get their act together and agree on exactly what they're doing, and the president himself is a bit of a wild card here, repeal will be blocked. So with your help, with what's going on in town halls, with your education, I think we can block repeal and indeed make the Affordable Care Act better. Thank you.